The National Lung Cancer Audit looked at treatment patterns of stage 3 non-small lung cancer in England, and we found some important gaps or deficiencies in care. So the most important being that the NICE guidelines recommend for unresectable stage 3 cancer, you should have bimodality treatment, so that's either surgery with chemotherapy or chemotherapy and radiotherapy. And the recent NICE guidelines recommend that for resectable that you should get triple therapy, but this was before the advent of durvalumab being shown to be useful in terms of survival. And we found that only actually a fifth of patients was getting multimodality treatment in England, and that compares poorly with other countries, comparable countries. And in fact, the most common treatment or most common thing people were getting was no treatment at all, which about a third of patients were getting no treatment, and about 30% were getting palliative intent treatment. And that compares internationally with only about 13 to 18% of patients getting no treatment in other countries. And it corresponds with our poor survival rates. And we know generally in the UK our survival rates lag behind others in other countries, but particularly so for stage 3.